Welcome. Today I'd like to talk to you about an interesting case that recently came to us and is a young man who had a closed nasal fracture. So here is our patient, a handsome young man who was playing on a water slide when he was accidentally struck in the face. And you can see the pushed in nature of the right side of his nasal bones and how his entire nasal pyramid seems to be shifted to the left. Next, we have some x-rays of the patient, and this is a CT scan of his head demonstrating a comminuted, which means in multiple pieces, nasal bone fracture, and you can see that the nasal bones are pushed over to his left side. This is completely consistent with his appearance in his photographs where the nasal bones are pushed over to the left side. This view is a similar CT scan of the nasal bones, but it's up a little bit higher, essentially to the mid-level of his eyes, again confirming a nasal bone fracture in multiple pieces that's pushed over to the left side. Next, we have a 3D CT scan of his face, and you can see again the nasal bones are fractured and pushed well over to the patient's left side. Here we have a diagram of essentially the fracture that our patient had, with the force coming in from the patient's right side pushing over the nasal bones, and the fractures are outlined in red. And so how do we fix these fractures? And the procedure is called a closed reduction. Closed meaning we don't make an incision. Reduction means just putting the nasal bones into proper position. And so with the patient asleep, we clean them all up and so on, and then we basically introduce instrument into his nose to move the bones over to the patient's right side in this example, and also push the nasal bones over with our fingers. I like to do this in the operating room because sometimes these patients can have some significant nose bleeding with the procedure, and it's nice to have their airway controlled just so they don't aspirate any blood or anything like that. And so now we can look at some results from his procedure, and this is him preoperatively and pre-injury. And you can see a very handsome young man with a pretty straight nose. So here we see him post-injury and pre-op, and you can see that his nasal bones are kind of caved in on the right side of his nose and pushed over to the left side of his nose. Kind of the big reveal, right? You ever watch one of those home and garden shows where they do the kitchen? Kind of get their reveal. I think it looks like your pre-op picture.
What's that?
It means the pictures your mom showed me. You look very much like that. So here he is early post-operatively, and you can see that his nasal bones are much straighter. He doesn't have that caved in appearance on the right side of his nose, and his nasal pyramid's been pushed back over to the left side. And finally, just a composite view of all three pictures together, and we can see his preoperative and pre-injury status, and then right before the operation, and then subsequent post-operative image with restoration essentially to a normal appearance. And so it's important to remember that if we can get to nasal fractures early, that they can be treated with very little downside and downtime, and avoid the possibility for need for a nose job in the future.